So, good morning, Dr. Reggie from Trinity Health. I am so excited to be having this conversation with you. And thank you so very much for joining me so early this morning. I know that you have a full day, but I am grateful that you're going to be here for this conversation.
Mayor Suzette, it's my pleasure. And I look forward to having a conversation, which is a passion of both of ours. So I've learned since we have been in communication. So we've got a lot of work to do. So let's jump right in.
Excellent. So, um, here we are, Doctor. We are almost a year into this COVID-19 pandemic. It's clear to say that while we're almost a year in, there's still some things that we don't know, right? There's other strains popping up that we don't really understand. But we have a vaccine. We have two now, I believe, Pfizer and Moderna, and one coming up with Johnson and Johnson. So people are a little bit leery, and I can clearly say people in the African American community is even more so leery. So I'm going to ask you to do two things. One, give me a little bit of introduction about you for those that might be watching, and two, give me some information about this disease and then this vaccine.
Sure. Well, let me start by first applauding you for your leadership. I've been in Connecticut for almost 3 years now, and you stand out as a leader who has put a stake in the ground, both from a spiritual perspective, from a community of color perspective, and of course, as a mayor. And you want to make sure that your citizens or your constituents are in line to either make the decision to get vaccinated or in line to continue to wear their masks, social distance, etc. So I applaud you for your leadership and your commitment to your constituents. So I'm Reggie Eadie. I am the president and CEO of Trinity Health in New England. I'm also an emergency medicine physician, and I have a background as well in infectious disease. So this is a passion of mine. It is my first chance to really be community facing in the state of Connecticut since the governor asked that I participate as a co-chair of his vaccine advisory group. So I'm pretty close to what's happening. I'm also close to the science. And now I'm close to you in Bloomfield because we've got this initiative that we're going to move forward. So I'm excited. So let's talk about the disease. So if we take a step back and just look at the coronavirus, it's a family of viruses, which are not new. Now, many people who are not in the scientific space have never heard of it, but I recall many, many years ago in medical school when I was introduced to the coronavirus. The test question and the point that the lecturer was making when we talked about coronaviruses was that the coronavirus, for the most part, resided inside of animals, not humans. And some people consider humans animals, but let's just separate the two for the sake of the conversation. So they resided in the human most commonly. So we've never had a problem with the coronavirus. There's an adenovirus, for example, that is in both humans and animals, and that's what causes the common cold. All of a sudden, we saw probably just over a year, closer to a year and a half, a mutation or a variant within the coronavirus whereby it developed an affinity for the human cell. And so the way the coronavirus works, let me just kind of go through this, Mayor, very quickly. It's scientific, bear with me, but I think your constituents will appreciate just the basic information. So the coronavirus, the way it works, like other viruses, the coronavirus wants to, like a human being, it wants to survive. It wants to have a family. It wants to replicate. It wants to populate as much as it possibly can. So we kind of think of a virus that way. Instead of as a bad thing, we can better understand why it behaves the way it does. So the coronavirus wants to attach to a human cell. Once it attaches to a human cell, because it doesn't have the capability to reproduce on its own, it uses us as a host. And so it gets into our cells. So it really literally gets into our cells. And if you think about the picture or the illustration of a coronavirus, it's a circular object that has spikes sticking from it, protrusions. Those protrusions, I like to refer to them as arms and hands. So those protrusions grab onto a human cell, they punch a hole in the human cell, and then they deposit their RNA into the human cell. Once it deposits its RNA into the human cell, the RNA then has the job to produce another one of itself. So it hijacks our cells so that it can deposit its RNA, and then its RNA inside of our cells, it uses all of the energies and the vitamins and minerals inside of our cells that we get our energy from. it hijacks our cells and it produces yet another coronavirus. So it goes from 1 to 2, 2 to 4, 4 to 8, 8 to 16, 16 32, and all of a sudden, if that coronavirus takes over the nerves or the cells that are responsible for our smell, we lose our smell. Our taste, we lose our taste. Unfortunately, our lungs, when it takes over those cells, we have the inability to exchange, as we normally would, oxygen, and that's how many of the people across the world get into trouble and unfortunately have increased sickness and die. So that's how the coronavirus works. The most common way, Mayor, that the coronavirus has access to our cells is through our nose and our mouth. And when I say most common, I'm talking about the vast majority, north of 95% of the way we get infected by the coronavirus, it's through our nose and our mouth, which leads to the next point, and that is that the coronavirus is airborne. Right. So we used to, back in March, when we didn't know a lot about the virus, we were wiping down every single object in our home. We left packages on the front porch that Amazon or the food delivery left on the porch because we didn't want to take it. And my wife literally made me strip nude in the garage. She had clothes there for me to come in, and she instructed I go straight to the shower, clean myself off, and then I can come and have a conversation with her. So we know a lot more now. We know that it's airborne. What we also know, Mayor, is that because the majority of the infections, the vast majority, let's just say the way you get infected is through your nose and your mouth, the mask plays a very important part. So the narrative that it's not necessary to wear a mask is so far from the truth, number one. Number two, even if you wear a mask, you've got to wear the mask properly. So having gaps around the bridge of your nose and the side of the mask, not pulling the mask all the way down to the lower aspect of the chin, exposes the virus and gives it access to the cells in your nose and your mouth. So that's why the mask is important. Thank God we have a vaccine. We have not, first, early mid-December, we got Pfizer. Second, a couple of weeks later, we got Moderna. And now the Johnson & Johnson manufacturers have applied for emergency use authorization, which we hope to have by the end of this month. So that being said, let's just talk about each of those vaccines if you give approval to that. Great. So the Pfizer vaccine versus the Moderna vaccine. Let's kind of couple them together because the science is very, very similar. First of all, the reason why, and I need your audience to get this, because one of the hesitancy factors out there is because of the speed in which the vaccine was produced. So first and foremost, the reason why Pfizer and Moderna were able to produce the vaccine in such a short period of time. Remember, vaccines usually take about 6.5 years on average. They produce the vaccines in less than 12 months. So one begins to ask the question, well, how are you able to do that? I'm sure one would suggest that it impacted efficacy, meaning how effective the vaccine is, the safety of the vaccine, the quality of the vaccine, and did they skip steps? My response to you is no, they did not skip any steps. It did not negatively impact the efficacy, quality, and safety of the vaccine. So let's talk about this so-called mRNA or RNA technology. For those in the audience who are listening, you probably remember that your DNA in every single cell in your body, you get half from your mom and half from your dad. So that's your DNA. DNA, another word for it, is a genetic code or an instruction manual. So when you think about how when you buy a box of a product and you bring it home, the first thing you do if you're going to assemble it is you review the instruction manual. You simply follow those instructions. That's what DNA is inside of your cell. It's just an instruction manual. Second to the DNA is the RNA. The RNA actually does the work. So the RNA would be equivalent to me opening up a box at home and assembling something that I bought from, let's say, Walmart. So RNA does the same thing in your cell. It reads the instruction manual and it produces whatever your DNA tells it to produce. That's why our skin color is the way it is, why we have the lips and the nose and the eyes and the size feet that we have, because our parents determine the DNA. We got that from our parents. The RNA inside the cells produces whatever it needs to produce, like a protein or replacing the skin cells on your skin or the cells on your feet, whatever the case is. So scientists many, many years ago, this is not new, so that's the second hesitancy factor that we hear out there. Scientists many years ago had taken this new RNA technology and was working on a vaccine and a cure for cancer. while they were still working on that, this pandemic hit. They stopped the line on that scientific research, and they transferred their energies and this new technology to creating the vaccine. So here's how the vaccine works. So they took a coronavirus to the laboratory. They opened up the coronavirus. They pulled out the RNA. Now the RNA, which really, remember, it does the work from what the DNA says, what you got from your parents. They took the strand of RNA, which has the code for and the ability to assemble the entire coronavirus. And instead of injecting the entire RNA into the human, which if they did, your cells would be producing more coronaviruses. They decided not to do that, because if they did that, here's another narrative, then the vaccine would give you coronavirus. They instead took the entire RNA. They found the part of the RNA that only produces the spike protein, that protrusion on the picture of the coronaviruses that you see. So they cut that piece out, took that to another laboratory, and created a vaccine. So the vaccine, which you may or may not receive from Pfizer and Moderna, is an injection of the RNA from the coronavirus that is only responsible for producing the spike protein. So once you get injected, and I have received both Pfizer vaccines, I'd be happy to talk about that from a personal perspective. But once you receive the Pfizer Moderna vaccine, your cells are tricked to produce spike proteins. You produce antibodies, because it's foreign, to the spike proteins, which prepares you from an immunity perspective, so that if you're exposed to the real coronavirus and it gets through your nose or your mouth, it tries to grab onto one of your cells, punch holes, and deposits its entire RNA. The first step from that coronavirus infecting your cell is it has to grab onto it through the spike proteins. If you have antibodies to the spike proteins, when it tries to grab onto your cells, it's stopped and you are immune, which means you will not get coronavirus. Now, the efficacy for Pfizer is 95%, which means 5 people out of 100 could still get coronavirus. The efficacy for Moderna is 94.5%, which means that 5.5% of people, or 5.5 out of every 100, could still get coronavirus. So it doesn't have a 100% efficacy. However, even if you still get, after being vaccinated, exposed to and infected by it, 2 things will not happen. You will not get so sick so that you need to be hospitalized, and you will not die from coronavirus. So that's why me and my family decided that the right thing to do was to get vaccinated. I got my first Pfizer vaccine on the 21st of December. 14 days later, I received my second. My wife gets her second Moderna shot today. She's a nurse, so she qualified. And so we're proud and happy that, 10 to 14 days after your second injection, then you should have that 95 or 94.5% efficacy. You don't have to worry about being hospitalized. You don't have to worry about dying. Let me say one more thing before I yield the mic back to you, Mayor. Now there's Johnson & Johnson. So what's the difference between Johnson & Johnson as well as Pfizer and Moderna, which we classified to put in the same bucket? They're very much similar because they use the RNA technology. The only major difference between the Johnson & Johnson and the Pfizer is, one, they don't just use the RNA technology. They take an adenovirus, which is the virus that causes the cold. They deactivate it, and then they put the RNA technology. So they bring the old and the new, because we've been exposed to injecting viruses, measles, mumps, and rubella, the influenza, the flu vaccine. So we already have done that. So don't let that deter you from considering it. They take the adenovirus, they deactivate it, so you won't get sick. If you did, you would only get a cold. They inject the new RNA technology, that RNA piece that produces the spike protein, into the adenovirus, and they inject that into the human. And then that is how you develop immunity. The other difference is that Pfizer and Moderna were 2 shots, 21 and 28 days apart respectively. Johnson & Johnson's only 1 shot. The third difference is the efficacy. Now, we talked about 95 and 94.5 for Pfizer and Moderna respectively. The efficacy for Johnson & Johnson is anywhere between 72 and 85%. But the difference is, in that efficacy, is that they're probably not different at all, because Johnson & Johnson, because it came later, it took into its research the variants. So the fact that it goes as high as 85% in the face of the variants My guess is if you did Pfizer and Moderna in the face of the variants, they would drop down to about 85% as well. So all three of them are essentially the same because they're all based on the RNA technology. And there was enough for me, plus other things that may come out in this conversation, to convince me and my family and to give me the comfort to say that being vaccinated is something that we should not really think twice about, but we should get in line as quickly as possible once eligible, roll up our sleeves and get it done so that we can, as a Bloomfield, become as safe and as healthy through this pandemic as possible.
Excellent. I am so I'm so interested and intrigued and excited by the science, but I do also know my limitations, and that's why I get the experts to explain to our residents about this vaccine. So one of the things that you said, which was very important, was that they were already working on a vaccine. So some people, their concern is it just came up out of nowhere. Yeah. How in the world can we come up with a vaccine in months when it usually takes years? Yep. Right? So I know that you talked about that, but just give me a little snippet about that again. The fact that it's not that it just popped up. There was already work being done.
Yeah, so, Dr. Eadie, who was very close to this kind of work, who was blessed enough to be tapped on the shoulder to, in my mind, work with the governor as well as represent people of color, it was a privilege for me to do so. I thought hard and long about saying no. And my main reason was because of that same point you just raised. I was saying to myself, I don't know enough about how in the heck they were able to produce this vaccine in less than 12 months. That has never happened before. But then I remembered and learned more about the technology that had already been in existence for cancer. So it's no different, kind of, sort of, than if someone said, hey, we need an automobile in a town in Connecticut that has never had a car and the residents have never seen a car. And then someone says, I'll be right back. And they go around the corner, they grab a car and drive around the corner. And then the people in this one town, in this analogy, says, well, where'd you get that car from? Like, we've never seen a car before, and I'm not trusting the fact that I should get behind the wheel or even as a passenger and ride with you. But then when the story is told and the facts are laid on the table, cars have already been in existence since Henry Ford invented them many, many, many years ago. And it was just that we people had not been, in this analogy, been exposed to the car. The same thing is applicable to the RNA technology. It had already existed. It was not a topic. It was not a conversation. It was done in a silo, if you will. Only the scientific world, the researchers, knew about it. When the pandemic hit, everyone's dying. I mean, today we have 3,000 to 4,000 people. Let's think about that for a second. 3,000 to 4,000 people dying every single day. So although it wasn't that many at the time, people were afraid. We were scared to death, right? Literally scared to death. I mean, people were dying, we know, from heart attacks, strokes, and other incidences because they were in the midst of the pandemic, and it appeared as if the world was crumbling. So they took that new technology, introduced it to the problem that was current in the United States of America, and that is we're in the midst of a pandemic with a number of people dying every single day. We knew very little about this virus, but we did know enough about the coronavirus and had this RNA technology where they can couple them together and create, in a very short period of time, the vaccine. So I just thank God for the science. I thank God that the science existed, because imagine, and this is what I say to people when they question how quick it was provided, which I believe to be a blessing from God. Imagine if we had to wait 6 years, which is the average amount of time it takes to make a vaccine, before a vaccine was available. I mean, so many people at the rate of 3,000 to 4,000 people a day. Eventually, Mayor, it would be me and you, and probably the third or fourth year, guessing, and we would be the ones that fall to our demise because of this pandemic. So that's my response to that. And we need to look at the bright side, the positive aspect of the truth, and that is that it is not a new science. It was not conspired. It was already there. They just shifted toward focusing on the pandemic, and thank God that's how we were able to get a vaccine in a short period of time. But vaccines by themselves don't save people. It's the vaccination that does. And so that's why this conversation is so timely and important for Bloomfield, because we really need people to get this. We realize we have to answer your questions, address your concerns. But remember Hosea 4:6, I think it is, that says the people perish because of lack of knowledge. We are sharing the knowledge in this conversation so that you won't perish. They perish because they rejected the knowledge. And these are the facts. I am not giving you my opinion. When I do, I will state as my opinion. But scientifically, this is the right thing to do, the right way to go, and the way we get through this pandemic as a Bloomfield.
Yes, Dr. Reggie, yes. So we're also having a disconnect with people of color and their receptiveness to the vaccine. Now, clearly, you are a man of color. How do you think that we can reach our people to let them know that this is of utmost importance for them?
So that's a great question. I mean, there's no playbook on any of this. We are sort of building the bridge as we cross it, I like to say. So I think the first thing and I've learned a lot. I've learned a lot just from research. I learned more from talking to people and understanding where they are in their space in life. And I have to learn more about that and become more sensitive to that. The first thing I've learned to do was to acknowledge the fact that we completely understand why you're hesitant. We completely understand your anxiety. We completely understand why you don't trust healthcare. And that's huge for us to do, right? Because we have to acknowledge sort of a mistake that was made in our minds to assume that you shouldn't be thinking that way. And also, there was a big mistake that was demonstrated by the United States government. So, for example, the most common narrative is that Tuskegee syphilis, untreated syphilis in African-American men study. These were over 600 African-American men from the Tuskegee, Alabama area, over 600. And they were tricked because they were told, we will give you free health care if you come to this clinic. Free health care, everyone wants that because the number one cause of bankruptcy in America is what? Healthcare bills. So the fact that we're giving free health care is great. Now we come into a clinic, these 600 plus African-American men, and either they had syphilis or they were given syphilis. That piece has not really been explored yet, but nonetheless, they all had syphilis. Knowing they had syphilis, this was from 1932 to 1972, knowing they had syphilis for those 40 years. And remember, penicillin was out. In fact, in 1947, if I remember correctly, penicillin was declared the standard treatment for syphilis. So for 25 more years at least, they knew these men had syphilis and they did not treat them. Syphilis is not a benign disease. As bad as gonorrhea, chlamydia, and herpes could be, syphilis impacts your central nervous system. You really don't have a chance once you're diagnosed with syphilis if it's untreated. You just don't. To live the life that we all deserve to live here in America, you get syphilis, you need to be treated as quickly as possible. These people weren't treated, which is why in 1997, President Clinton stood in front of the world and said, we did you wrong and we apologize. So I completely understand why people are hesitant. We've all had our experiences of racism in the healthcare space in one point of our life. So I get it. But in the face of 3,000 to 4,000 people dying every single day, unless you have an alternative to this, then what's the best route to go, right? So God bless the child who has his own. We have our own. This is not a Caucasian male's disease to do bad people wrong. Why do you say that, Eadie? I say that because what we know in America and what we see here in Connecticut is that the majority of people that are getting vaccinated are not only Caucasian, but they're Caucasian people who are coming from their neighborhoods to brown and black neighborhoods to get vaccinated. So if it really was a bad thing, and remember, we're humans, we all have similar genes. If it really was a bad thing, then they too wouldn't be in line. So I think it's time for us, again, in the face of 3,000 to 4,000 people dying every single day, to dismiss that part of it as best we can. And let's move on to the next level of anxiety, the microchip. Listen, first of all, that would be detectable. 1, 2, why would the US government wait until a pandemic to put microchips aren't new. They've been around for many, many years. My dog, before my last dog, had a microchip in it in case the dog ran away. It could be scanned and we can have the dog return home safely. So this is, and the other point about the microchip is this is the most transparent medication that has ever existed in this country since the day of medicine. What I mean by that is Dr. Eadie could give you a 2-hour presentation on the coronavirus and the vaccines. But if you ask me about the blood pressure medication I took about 6 a.m. this morning, I can give you the name of it and maybe the manufacturer. And that's all I can tell you, and the dosage and how often I take it. But I couldn't give you a 2-hour presentation on it because I don't know anything about it because I'm not researching. Everyone knows about it. And thank goodness to you, Mayor, and your leadership, the people that are viewing this, they now know because they're going to be experts too. Everyone knows about what's happening with the vaccine. So this is no secrecy. This is no conspiracy. This is simply us trying to get us all through this pandemic. And when you look at the deaths, we all know that although grossly more Caucasians are dying every single day, when you look at the disproportionate rate of deaths, meaning more African Americans per our population in this country are dying at a much higher rate. So shame on us if we sit back and do nothing. Doing nothing, we can forecast the outcome. You and I will eventually succumb to this virus, but doing something is how we change the trajectory. And the something that I would propose to Bloomfield is getting vaccinated.
Wow, Dr. Eadie, thank you so much. I think that's the message, right? I like what you said. If we do nothing, we can definitely tell what that outcome is going to be. But if we do something, it's going to help us. And the town of Bloomfield is partnering with Dr. Eadie and Trinity Health, along with our West Hartford Bloomfield Health District, to make sure that our residents have all the information that they need so that they can make an informed decision. I came to the gentleman that can talk about the science, and he did that so eloquently and with such depth that I'm hoping that this information will help you on your path to making the right decision or the best decision for you and your family. And I heard, because I'm in the clinics sometime, this one lady got her first vaccine on Tuesday, and she just started crying. First of all, she didn't know that the vaccine was already done. So when we convinced her that, yes, you actually got the vaccine, ma'am, she said, you're saving my life. But she said, most importantly, I'm going to be able to get to meet my great-granddaughter, which I haven't met yet. So you're giving me time to be able to meet my great-granddaughter. And that to me was just, you hear stories of people once they've gotten their vaccine. And if they've gotten their vaccine, I'm going to talk to you about that in a minute, you tell them, well, you know, you're probably going to get a little sore at the injection site. So when you go home, take some Motrin or something like that, just in case you're a little sore, or get it in the arm that you don't sleep on. But hey, wait a minute, when you get your second shot, it might hit a little bit differently. So I just want you to touch briefly on that, because I do know that your time is precious and valuable. And once again, thank you so much for being with me this morning. But if you can hit a little bit on that so that people aren't taken by surprise, number one, and number two, that they're not scared. Because I think, let me tell you, that the anticipation of the vaccine is actually worse than getting the vaccine. So if you can just touch on that for me a little bit.
Yeah, absolutely. So first of all, let me start by saying that we divide the side effects, if you will, from, and I hate to call them side effects. The side effects are usually viewed as being negative. I'll talk about that in just a second. But we divide the side effects from the vaccines into two: 55 and older and 54 and younger. So that means that what we're doing here is that people who are 55 and older are less likely to have severe side effects. Those that are 54 and younger are more likely to have severe side effects. So that's one point to take home. The second is that side effects are a sign that the vaccine is working. So side effects, it's a great thing. I hoped and prayed I had severe side effects, because I knew that I would be mounting an immune system, or activating my immune system to mount an immunity to the virus. Now, I didn't get a lot of side effects. I'll talk about that in just a second. But even if I did, and even if they were severe, I didn't have a problem, because I know that regardless of your age group, regardless of what vaccine you get, the side effects are going to be gone within 24 hours. So it's like the 24-hour flu. So what are the side effects? So side effects are just like the flu. First of all, you may have soreness at the injection site, but then like the flu, you're going to have body aches, fevers, chills. You could have nausea and vomiting. You could have diarrhea, although diarrhea is very uncommon. The most common side effects are headache, fatigue, and body aches. So headache, fatigue, and body aches, 6 to 8 hours after your shot and gone within 24 hours is the worst that you, in most cases, can anticipate. Again, less or more depending upon your age. So that's really the take-home message. Side effects are not a bad thing. They resolve within 24 hours. And then there's the gamut of the side effects that I just described that you can look to experience. My wife got her second injection on a Friday today because she didn't want to have to miss work, and she figured I can just relax over the weekend. But she knew that if she got it today, tomorrow, 24 hours later at that time, and she's getting it early this morning, she would be just fine. So she can still do her Saturday in the event that she gets some side effects. Side effects are not a bad thing. They will resolve within 24 hours, and the younger you are, the less likely you are to get it. Now, one more point I like to make is that the second injection, or if you've had coronavirus before, then you should expect to have more severe, moderate to severe side effects. And why is that? Because when you get your first injection, or the first time or if you've had corona, you already have antibodies in your body. When you get your second injection, now the antibodies are standing on guard, if you will, waiting for a coronavirus or anything that looks like coronavirus to show up. They're ready for the fight. On your second injection, or if you've already had coronavirus on your first injection and then your second injection, since you already have antibodies, they are going to just attack that, and then you're going to get more side effects. So people who have had the coronavirus will have more side effects than those who have not, and then people who have not will have more side effects on the second injection after the first.
Excellent. Thank you, Dr. Eadie. So here it is in just one quick 3-second plug. What is your ask for anyone that's watching this?
Sure. There's only two ways that we can get herd immunity, which is the ultimate goal. Herd immunity is what we have to reach before we remove our masks, stop social distancing. The two ways to do it is through exposure. That is, was watching to see what happens with the virus, 3,000 to 4,000 people dying a day. I'm not trying to go that road. The only other way to reach herd immunity is through vaccinations. My plea, I beseech the people in Bloomfield, whether you are a clergy person, a lay person, whether you're educated or not, whether your skin is colored or not colored, the right thing to do for us is to first get exposed to this information that we shared today and make your decision. And to the extent where you have decided, and we need about 80 to 85% of people on the planet in order to reach herd immunity to get vaccinated, once your eligibility comes up, please run to the line and get vaccinated. To the extent where we can help you navigate through the system to get vaccinated, just reach out to St. Francis or Trinity of New England. Any of our hospitals will gladly do it. And I think most importantly, I'll say that to the extent you have more concerns and more questions, please reach out to Mayor Suzette's office, and her and I will partner to ensure that you have the information you need to, as she indicated earlier, to make an intelligent decision around what you and your family should do. God bless you all, and let's get through this thing together.
Excellent. Thank you, Dr. Eadie. Bloomfield, we are going to get through this together. I am grateful for the partnership with Dr. Eadie and Trinity Health. I'm grateful for the partnership of the West Hartford Bloomfield Health District. I'm grateful for the partnership with our faith community. And most importantly, I'm grateful for being able to serve the most wonderful, the nicest town in the state of Connecticut. Once again, Dr. Eadie, thank you so very much.